The Dalhatu Referral Specialist Hospital Dash is the only tertiary health institution owned by the Nasarawa state government. Being in existence for more than 30 years, the hospital has a clear-cut mandate of providing services, training of medical personnel, and carrying out research. The state government and the management of the hospital are repositioning it to meet with international best practices.
All along, the concentration has always been on service delivery, while tertiary institutions are supposed to have at least three core mandates. One is the service delivery, second is training, and third is research. And they are all as important as the other.
In the last 2 years, under the Abdullahi Slade-led administration, the hospital commenced the training of doctors to be consultants. This is aimed at boosting its manpower resources to meet with the ever-growing demands of patients.
So, the hospital is supposed to be a training institution, especially for specialized areas of medicine. And in the last 2 years, we have started and concentrated on this aspect of our mandate, which is training doctors, that is to become consultant. Train doctors post NYSC and then begin to train them in the different areas of specialization of medicine until they become consultant. And just in the last 6 months, we have gotten 6 new consultants. Altogether, we have produced about 15 consultants in this hospital from our training processes. And all is kudos to the attention that the government has been giving the hospital and the support that we've been having for the training, because it costs a lot for you to have the basic equipment and manpower that will give you accreditation to do this training.
Some consultants who are products of the hospital speak on the impact of the training.
Yes, the residency training in Obs and Gynae department in Dash is of high quality because this place is a referral center where many patients are being referred to, and we see a lot of complicated cases in these hospitals. So this has actually given us opportunities to manage patients with complications properly. And also during the course of the training, we were exposed to so many complicated cases. That's another advantage of being trained in this hospital. Then apart from that, another advantage of being trained in this hospital is that we have our trainers, that is our consultants, always available at every point in time to put us through and to supervise the training. So this has actually helped to improve the quality of trainings that we have actually received in this hospital.
Training in Dash is quite good. Recently, it has produced several consultants in O&G, in family medicine, and then in pediatrics. As a consultant, I've gotten the requisite knowledge and skill to do more than the average doctor will do. So it will enable me give the best of care to my patient, and it has also the training has also empowered me to be able to train other doctors, to give them postgraduate training, and make them become good specialists.
And then the new Dash policy, communication skills. No matter the information you have.
The hospital embarked on the retraining and reorientation of all strata of workers. The aim is to improve on its staff-patient relationship in order to boost service delivery.
The management decided that there was a need to reorient the entire workforce of Dalhatu Arab Specialist Hospital. One, because of patients' complaints in terms of service delivery. When they come to the hospital, the waiting time, how they are attended to. And so management decided that there was a need to retrain or reorient all the staff so that our knowledge, skills, and attitudes will align with the vision of the hospital, which is quality service delivery to patients.
The staff are optimistic that the training will further enhance their capacity to deliver on the job.
Well, the training, or rather retraining, was actually good, and on my own part, it will help me. It will help me to know how to treat my patients and others. Not that we don't know how to treat them or weren't trained, but at times the work can be so overwhelming. But with this, it's kind of a reminder for you to treat them with much love, patience, and tolerance.
I'm being trained to ensure that patients are being well taken care of here in the hospital. Make sure they are comfortable, because some of them are being here for the first time. So my duty is to make sure they are okay while they are.
The state government recently procured 2 dialysis machines for the treatment of kidney diseases in the hospital.
Disinfectant. That's what you can see from it. It's heat disinfectant. You have to disinfect it first. As it's boiling, you disinfect it for 5 minutes.
With the coming of the administration, and they felt it is good to have new machines on ground so that our patients will not suffer. And so the government, in its own way, produced 2 Fresenius machines, and they are quite new, and the model is the best of all in the country. And so they produced 2, and since these machines came, we no longer refer our patients out again. So we continue to dialyze them, and some of them get out of the kidney problems, some go into end stage, and we continue to dialyze them.
There was a time that almost all the machines in the hospital broke down. But now we have taken delivery of new machines, and our dialysis center is back on its foot. And people don't have to travel now to Abuja, to Jos, and it is a big relief to people with those illnesses. In fact, we have already started receiving patients from even neighboring states, local government that are closer to Lafia. People coming here to access the services.
The hospital has transformed the eye clinic into a full-fledged complex. It has also increased manpower to cater for the numerous eye diseases.
Initially, or in the past, we had just, I think, 2 or 3 rooms that comprised the eye clinic or eye department in the hospital. And eye elements are among the most common almost anywhere in Nigeria. So we needed expansion, we needed additional staffing, and we've gotten the additional staffing. We have expanded the eye clinic or eye department, and now we have a complex, a modern complex for eye elements, and it has gone a long way in alleviating the suffering of people here. In the past, people used to go as far as Kano, Gombe, Bauchi to access eye care. But now we have a modern complex, we have consultants, we have residents that are providing those services.
See the works in terms of a range of eye diseases. Commonly we have allergic conjunctivitis, which becomes worse in certain seasons, like the dry seasons we are at now. We have other conditions that may be blinding, like cataract, which is the commonest cause of blindness. We also see a huge number of patients coming with glaucoma. We see chalazion, we see pterygium, we see all kinds of eye diseases. Some range from diseases caused by systemic conditions like diabetes, hypertension, people with thyroid eye disease. So we see a range of eye diseases.
Jato Emmanuel and Mohammed Likita are patients at the eye complex. They are delighted with the state government for providing an ophthalmology unit of international standard.
They are doing their best, because if you see the rate of patient dropping here, if they are not doing their best, you can't see anybody here. But because of the facilities they have and the competencies they have, the patients are dropping here for the eye treatments and the rest of them.
It's very, very good, sir. And they are serving you very well. I will say thank you for the government of Nasarawa State, and I will say thank you for the governor of Nasarawa State, and even the CMD here. They are doing well. us.
This is the mammography unit of the hospital, and work is already at advanced stage. The center, when fully completed by the state government, would cater for the screening and diagnosis of breast cancer.
That is the center where we do screening and diagnosis for women with suspected breast cancers or breast lumps. We used to have a very small place in the hospital in the past and easily getting overwhelmed. But now the government is building a state-of-the-art modern mammography center in the hospital, one of its kind in the north central Nigeria, and it's almost 90% completed now.
The hospital is also equipped with modern state-of-the-art ICT center. The center would afford staff the ample opportunity to be ICT savvy and carry out research works.
We use it for training of our staffs, and then subsequently we want to be training people outside that are interested too. And then we also use it as a business center to generate revenue for the hospital, and then for research purposes for our medical personnel.
We are into the modern world now, and you cannot effectively and efficiently run this kind of services that we are without the aid of ICT. And so the government has made for us state-of-the-art ICT center in the hospital, and we have already started using it, and we are already seeing a lot of the benefits. And the ICT center not only provide ICT services for our functions in the hospital, but we also use the place for training of all our health workers on ICT. Because right now we have gone digital, we have gone into almost electronic everything in the hospital. So there is that need for all our workers to be ICT compliant, and training is currently ongoing for almost everybody in the hospital on ICT. Then apart from the ICT services that is being provided for the hospital.
The hospital has recorded major breakthroughs in diseases prevalent in the state.
Again, one of the core mandates of the hospital is to undertake research, and we are more concerned on researches on disease conditions that are prevalent in our state in particular, so that we'll be able to know what are the causes of some of these diseases. Not that we're just sitting in the hospital and just receiving patients. For example, if people are coming with diarrheal diseases in particular location, maybe a local government or a village, you will want to go and check what could be the cause. Is it the water they're drinking? Is it the food? What could be the cause? So in some places, just sinking a borehole will stop all the patients that are coming from those areas. If, for example, you have a local government where in a particular period you discover that a lot of people are coming from that particular village with hepatitis B, you want to go and see what is causing the hepatitis B, what are the things that are happening there that is causing this problem. So we have embarked on that, and so far we have published over 10 papers within the last 1 year out of this research effort, which is for our environment and hospital of our status is almost unprecedented.
Having ensured adequate funding for the hospital, the Nasarawa State Governor is impressed with the successes recorded, especially in the management of COVID-19.
Let me commend the relentless commitment of our frontline health workers, especially right here in Dash and all our other hospitals in the state, especially again during this very, very difficult time of COVID-19. I want to thank you for your support.
Almost all the achievement that we have made or we are making is because of the support of the state government. We hardly ask for anything that is not granted. Once it is health, the government has taken health as a number one priority. And it sees health as social services, not profit-making services. So our demands are much. We are almost always going to the government for we need this. But once it is health as something that is going to impact positively on the people, the government almost always accedes to our demands.
Going by the reformation efforts of the state government in the hospital, DASH can now stand tall among community of tertiary health institutions in the world. Affordable housing is one of the necessities of life. In Nigeria, the housing gap is one of the major challenges confronting the average citizen, especially the low-income earners.
The problems of the Nigerian housing industry.
The Fuller Foundation is aware of this anomaly and it is leveraging on this to provide adequate housing for Nigerians. This informed the construction of 1,000 housing units in Kara local government of Nasarawa state. The aim is to provide affordable housing for the people of the state and workers of the Federal Capital Territory who reside in the state.
The entire estate consists of 248 units made up of 5 housing types as follows. 6 studios that are expandable to 2-bedroom units, or they just start off as studios, 116 1-bedroom units expandable to 2-bedroom, and 64 2-bedroom semi-detached units. We have also 13 2-bedroom stand-alone units like the unit we just saw on our way here that we dedicated as our 1,000 house. We also have 49 2-bedroom units expandable to 3 bedrooms. The estate comprises both semi-finished and shell unit options, where the houses are finished externally but inside left unfinished, so homeowners can finish it up to their taste. The semi-finished units are, however, livable, as all wet areas are completed with tiles and water and power connection to the homes.
The Vice President of Nigeria and the Nasarawa State Governor are delighted to inaugurate the project. For them, the structures would ameliorate the plight of the low-income earners and enable them to own their own houses.
Whilst the challenge of inadequate or no housing undermines the quality of life of so many Nigerians, it also denies our economy and therefore our collective welfare, the growth that is possible through even a vibrant housing market. So it's not just that it is bad not to have good houses. It's not good for the economy. Most places in the world where you have a house, it also means that the economy becomes more vibrant because you can use your house as collateral to borrow money in order to do business.
I am highly delighted today to see the results are positive, and then indeed they are beneficiaries, and they are the beneficiaries he told me. I congratulate you really for what you have just done. I'm therefore pleased to join His Excellency Mr. Vice President of the Federal Republic of Nigeria and other distinguished guests for the launch of this laudable housing initiative in our state. I also call on other investors and other stakeholders to take advantage of our business environment and reforms in our state.
Honourable Minister, the Chairman and CEO of the Millard Fuller Foundation and the good people of Masaka, it is my privilege and pleasure to officially commission the Grand Louveau 3B estate for the benefit of all Nigerians who own homes here and to the glory of the Almighty God.
Beneficiaries of the scheme are overwhelmed and want all levels of government to invest in housing.
To the glory of God, I'm standing here today, having been one of the homeowners. God made it available. Now, I want to say thank you to the person that got this idea to build low-income houses for people like us. And I also want to encourage the government if they can assist, because there are a lot of people out there sleeping on the street. There are a lot of people out there that would like to partake in something like this, where they can be paying for their monthly rent, and at the end of the day, it becomes their houses.
The Fuller Foundation Housing Project is one among many other private housing investments underway, courtesy of the land-friendly policy of the state government. The Nasarawa State Teachers Service Commission says it is committed to transparency and merit in the ongoing recruitment of teachers in the state. Executive Chairman of the Commission, Abdullahi Galadima, reviewed this in an exclusive interview with TVC News.
The Nasarawa State Teachers Service Commission is receiving attention so much from His Excellency, the Executive Governor of Nasarawa State, Engineer Abdullah Alhaji Sule, in the sense that since we came on board, this commission had seen a lot of transformation and a lot of changes that either were not in operation before now. But with its coming, we have a lot of things that are happening. Recruitments have been done before, but this time around, it is online. The registration is online. We've opened portal by the BICT. They have opened a portal for this recruitment exercise, and the applicants have all applied online, and the application was free. So therefore, after the exercise, about 3 weeks, 2 weeks was given for the application, for the applicants to apply online. After this exercise, after the registration, the compilation of the list was made by BICT and sent to us, and from there, about 10% of the total applicants were scrutinized and invited for the CBT test, of which it has not been in practice. So this process is almost being completed.
Okay, as the chairman, would you say the process this time around is more transparent and, of course, less expensive than the previous ones that have been held?
Well, on the side of the applicants, yes, it is less expensive because it is free. And at the same time, the government had to pay for the examination, and that is the aspect. And the issue of transparency, that you should expect that, because this is a process that you don't see whatever you assess all this thing at the internet, and so we have the belief that as much as possible with the policy now, transparency is actually observed. You can see. Yes.
Thank you very much.
And at the same time, well, after the test, as it has always been, His Excellency wants the best. He wants the best from the teachers, because he has vision for education. And with this transparency, we're expecting, and at the same time, we have the belief that whoever might be employed from this process, we have to see that that person is genuinely to be a teacher. It's unlike before that people who want to manage teaching were just recruited into the service. But from this, we are looking for professional teachers. And those that have passed the exams, their certificates or credentials will be scrutinized to ensure that they are educationists to the core, and also must have registered with the National Teachers Registration Council of Nigeria to become teachers. And so for those that are not, we have the belief that they should not very much try to impose themselves into the teaching profession, because teaching has now been professionalized. It is now a professional organization. And so we want only people who are professionally qualified to be able to stay in the classroom. Why I'm saying this is that most of them that were not educationists and are now teaching in our schools, look at teaching as where they manage. Wherever they get their own professional area, they will abandon the teaching line and then go to that. For instance, those who read social sciences, especially in public administration, political science, and the like. But today, in Nasarawa State, we are really looking for science-oriented teachers. And we have the leverage for those of them that might have read physics and have good grades, English, mathematics, and of course chemistry. we'll take a good look at them, even if they are not educationists. We'll try to see how best to utilize some of